Why has the number of measles cases been rising so rapidly all over the world? Michael Snyder reports. Have you noticed that stories about measles have been popping up in the news a lot lately? At first I didn't pay much attention, but then I decided to look into what is going on, and I was quite alarmed by what I found. At one time, measles was a disease that was on the verge of being totally defeated, but now it's back with a vengeance. According to the World Health Organization, the number of measles cases in Europe in 2023 was 45 times higher than it was in 2022. There was an alarming nearly 45-fold increase in measles cases in Europe last year, the World Health Organization WHO says. Health chiefs are warning that cases are still rising and urgent measures are needed to prevent further spread. Some 42,200 people were infected in 2023 compared to 941 during the whole of 2022. What could possibly account for an increase of this magnitude? I don't know, because it isn't supposed to be able to happen. We're being told that Russia and Kazakhstan each reported approximately 10,000 cases during the first 10 months of the last year. Russia and Kazakhstan fared the worst, with about 10,000 cases each from January to October last year. In Western Europe, Britain had the most cases with 183. The WHO said there were nearly 21,000 hospitalizations and 5 measles-related deaths on the January to October period in the 51 countries in its European region. Why is Russia being hit so hard? Could this have anything to do with the war in Ukraine? I don't know. Of course, cases of measles have been spiking in many other parts of the globe as well. Here in the United States, there have been outbreaks in Pennsylvania, Virginia, Georgia during the past couple of months. Nearly a dozen cases of measles have been reported in Pennsylvania, Virginia, and Georgia in recent weeks, according to local health departments. International travel, coupled with declining global vaccination rates, is probably behind this spate of cases, experts say. The Philadelphia Department of Public Health has confirmed at least 9 cases of measles over the past month after a person contracted the highly contagious virus outside the United States and exposed a parent and child at a children's hospital, according to Health Department spokesperson James Garrow. That exposure led to a Philadelphia daycare outbreak that included at least 5 children. Once measles appears in a community, it can spread very rapidly, and that's because it's extremely contagious. But unlike other viruses, measles is so contagious that up to 90% of people who are close to an infected person will become infected if they are not immune to the virus, according to the Centers for Disease Control and Prevention, the CDC. It doesn't have to be cough right in your face. Stitchfield says tiny virus particles can survive in the air for 2 hours, where they circulate around and bounce over to this person and that person, and before you know it, you've exposed a lot of people, she says. What's more, a person infected with measles can spread the virus 4 days before the most obvious symptom, a telltale rash, appears. Hopefully, this measles scare will turn out to be nothing, but I will be keeping a very close eye on any future developments. Meanwhile, the H5N1 bird flu continues to kill vast numbers of birds and animals all over the planet. In Argentina, it's been spreading rapidly among seals, and almost all of the seal pups that get infected end up dead. Almost 96% of southern elephant seal pups across Argentina, born in 2023, have met a tragic end as a highly contagious strain of avian influenza continues to wreak havoc on wildlife. The scale of mortality sparks concern that the H5N1 strain is now capable of mammal-to-mammal infection. The sight of elephant seals found dead or dying along the breeding beaches can only be described as apocalyptic, says Wildlife Conservation Society WCS Health Director Chris Walzer. Once there is sustained mammal-to-mammal transmission, the transmission of H5N1, Scientists tells us that it probably is only a matter of time before there's an outbreak among humans, God forbid. And it's already bad, really bad news, because H5N1 can have a greater than 50% death rate among humans, according to the CDC. So we will watch for more reports that H5N1 is spreading among mammals. Earlier today, I found a story about a polar bear in Alaska that just died from that disease. A polar bear has been killed by bird flu as the highly contagious H5N1 virus spreads into the most remote parts of the planet. The death was confirmed in December by Alaska Department of Environmental Conservation. This is the first polar bear case reported for anywhere, Dr. Bob Gerlach, Alaska State Veterinarian, told Alaska Beacon. It was found near Utqiagvik, one of the northernmost communities in Alaska, 2 years after this latest strain was detected in North America. Needless to say, this is not a good sign. How did it get all the way up there? There's one more thing that I wanted to mention before I wrap up this article. Employees at a hospital in Denver have been given a live Ebola vaccine for preventative measures. A few medical employees at Denver Health made history Monday as some of the first people to receive the live Ebola vaccine for preventative measures, the hospital says. Ebola is a rare but deadly disease. In 2014, a major outbreak in West Africa led to some cases in the United States. While there are no known outbreaks in the world right now, members of Denver Health's high-risk infection team said they are some of the first to receive the live vaccine as a way to be prepared in the event of a future outbreak. If Ebola is not a threat in North America, then why do this? I don't understand. Over the past few years, there have been some tremendous public health scares, but I believe that what we have seen so far is nothing compared to what is coming. The diseases that are already circulating around the globe will continue to mutate, and it's inevitable that new outbreaks will erupt. In secret labs all over the planet, researchers are experimenting with some of the deadliest diseases ever known to humanity, and in many of those cases, they are actually trying to make those diseases even deadlier. And this is way too easy for an accident to happen, and once a bug gets loose, it can spread all over the world in the blink of an eye. Our ability to create great pestilences has far surpassed our ability to control them, and that represents a very serious existential threat to all of humanity, Michael Snyder reports. This is by Michael Snyder, and he says about the author, my name is Michael, and my brand new book entitled Chaos is now available in paperback and for Kindle on Amazon. In addition to my new book, I've written 7 other books that are available on Amazon, including 7-Year Apocalypse, Lost Prophecies of the Future America, The Beginning of the End, and Living a Life That Really Matters, commissions earned. When you purchase any of these books, you help to support the work that I'm doing. And one way that you can really help is by sending copies as gifts to family and friends. Time is short and I need help getting these warnings into the hands of as many people as possible. I have also started a brand new Substack newsletter, and I encourage you to subscribe so that you won't miss any of my articles. I've published thousands of articles on the Economic Collapse blog, End of the American Dream and the Most Important News, and the articles that I publish on those sites are republished on dozens of other prominent websites all over the globe. I always freely ask and happily allow others to republish my articles on their own websites, but I also ask that they include this about the author section with each article. The material contained in this article is for general information purposes only, and readers should consult licensed professionals before making any legal, business, financial, or health decisions. I encourage you to follow me on social media, Facebook and Twitter, and any way that you can share these articles with others is definitely a great help. These are such troubled times and people need hope. John 3:16 tells us about the hope that God has given us through Jesus Christ. For God so loved the world that he gave his only begotten Son, that whosoever believeth in him should not perish but have everlasting life. If you have not already done so, I strongly urge you to invite Jesus Christ to be your Lord and Savior today. This is by Michael Snyder on End of the American Dream. Please leave your comments and thank you for your support. Kindly support my Patreon account The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.